People often ask me, what is an eating disorder? To me, an eating disorder is where there's a significant disturbance in the way that somebody relates to food, their weight or their body image. There are lots of different types of eating disorders. The most common that I help to treat using psychotherapy is anorexia nervosa, bulimia nervosa and binge eating disorder. But there are also many other aspects that food play a part in people's emotional distress. So they might not have a specific category such as anorexia or bulimia, but if food is becoming difficult within somebody's life, then psychotherapy can be really helpful in understanding what is going on for somebody and to try and challenge the way that they're using food. A really important aspect of helping people with their food issues is an accurate assessment in order to be able to identify what is going on for the person and to develop the right treatment plan for them. The treatment plan can often include a referral to a psychotherapist such as myself to help understand the underlying reasons behind their emotional distress, which is really keeping the eating disorder going for them. We need to take into account the physical aspects that are going on for the person, but also the psychological, and that's where the role of psychotherapy really comes into play. My job is often to provide a safe environment for the person to explore what's going on for them and try and develop new ways of coping. Helping to identify the reasons behind the coping strategy they've adopted with food can be really vital to their recovery because it helps understand what might be going on for the person. There's many different approaches to psychotherapy that can be helpful with eating disorders, and that's why it's really important to get a good assessment for someone to identify what's going to be the most appropriate form of psychotherapy. I often utilise a number of techniques, but the most important to me is the therapeutic relationship. It's for the person that I'm working with to feel comfortable to be able to explore what is really going on for them. From my experience, it's never too early to access help. If someone is wondering whether they may have a problem with food or they may have an eating disorder, then a really good idea is to book an appointment with your GP just to talk it through, because the GP would be able to identify if there is a problem, and if so, would be able to refer to the most appropriate service or professional. And there are some fantastic services available on the NHS, but also privately. And if you are to go privately, I'd say look for an accredited therapist who has specific experience with working with eating disorders.